So the purpose of this video is going to be demonstrating the manual muscle test for the shoulder evaluation. First, I'm going to start with the deltoid musculature. So we have the anterior, middle, and posterior fibers of the deltoid, and you want to be able to differentiate those during your clinical assessment. So the first one is going to be the anterior fibers. So I'm going to ask Cole to bend his arm and basically push his arm into slight shoulder flexion, stabilizing the humerus, and then just pushing directly into extension. Remember, for all of these, you would compare bilaterally and hold for 5 seconds. For the middle deltoid, I'm going to bring him into 90 degrees of shoulder abduction, stabilize the humerus, and push him into shoulder adduction. Lastly, for the posterior fibers, I'm going to bring him back into shoulder extension, again with the elbow slightly flexed. I'm going to stabilize the humerus and push him into shoulder flexion. Good. For the coracobrachialis, Cole is going to make a dabbing motion. Yep, so kind of more so towards the other shoulder here. Good. I'm going to try to push him down into shoulder extension and shoulder abduction. Good. Relax. For the next ones, I want you to turn around. Next, we have the teres major. So remember, that is kind of on the lower aspect of the scapula. So I'm going to ask Cole to bend his elbow. He's going to go into shoulder extension and adduction, so going towards the midline. I'm going to stabilize the humerus and pull him into flexion and abduction. For the latissimus dorsi, I can have him seated or I could have him prone. For video purposes, I'm just going to keep him short-seated. So he's going to go into shoulder internal rotation, shoulder extension, and shoulder adduction. I'm going to, again, stabilize the humerus and try to pull him into shoulder flexion and abduction. You could also apply some slight external rotation to the arm as well, too. Good. Let's do the rhomboids next. So you're going to lay prone, so on your belly with your head here. So remember, we have on the posterior aspect of, on the back side of the posterior musculature on the back, we have the rhomboid minor and the rhomboid major. Rhomboid minor goes from C7 to T1, inserting on the medial border of the scapula. Rhomboid major goes from T2 to T5, inserting again on the medial border of the scapula. So you won't have to differentiate those for the clinical assessment. However, to assess those as a pair, you would have the patient almost making like a W with their arms. So Cole is going to bend his arms up. Good, just like that. And then I want you to pinch your shoulder blades here. Good. And I'm just providing a direct downward force. Good, and relax. For the middle trapezius fibers, he's going to make a thumbs up with both arms, with his arms fully extended. Good, so you want to make sure that he is externally rotated by keeping thumbs up towards the sky. He's going to pinch his shoulder blades here, and then I'm just going to provide a downward force in here. Biggest thing is remembering thumbs up towards the sky. Go ahead and relax. For the lower trapezius fibers, he's going to go in a V position. So this was a T, we've got a V. So he's going to reach up towards the sky. Good, making thumbs up. And I want you to pinch your shoulder blades here. I'm just going to provide a downward force again. So this is activating the lower fibers of the trapezius. Go ahead and relax. Lay on your back. We have the pec major fibers next. So you'll need to differentiate between the lower fibers and the upper fibers, or clavicular fibers. The lower fibers originate down by the sternum. So I'm going to have him at about 90 degrees of shoulder abduction. I'm going to stabilize the humerus, and I'm going to ask him to try to bring his arm across his body into horizontal adduction. Good, hold for 5, and relax. For the upper or the clavicular fibers, I'm going to bring him to about 110 degrees of shoulder flexion, and he's going to try to bring his arm across his body to the contralateral hip. Hold here and pull. Good, and relax. Lastly, we have the serratus anterior. So remember, that is the musculature that sits kind of right along the rib cage like this. So I'm going to have him in about 110 degrees or so of shoulder flexion. From this position, I'm going to ask Cole to make a fist and punch up towards the ceiling so his scapula comes off the table. Good. I'm going to basically put my hand behind his scapula. My other hand is just going directly on his fist and providing a downward force. Good, and relax.